my understanding from the available research, or at least what's been publicly communicated, is that people who've already safely had the first AstraZeneca dose are at dramatically lower risks of any kind of complications from the second dose, if not zero risks. Should it not be a relatively straightforward decision that if we aren't using the AstraZeneca we have for first doses, then we could at least start moving people into second doses and thereby free up potentially Pfizer and Moderna doses that would otherwise go to their second doses?
Well, thank you, John. It's a very good question, and I agree. The data we have from the UK, especially, if you did not have a so-called VITT event following the first one, it is highly unlikely that you are very low risk of having the second one. That's the UK data. It's about 1 in a million. You can imagine how low risk that is. We are asking our tables, Public Health Ontario, as well as the science table here in our area, to review that data to make sure that we're satisfied. So that is one of the real options we're looking at, to make sure that if we are going to recommend people do their second dose with the AstraZeneca vaccine, they have all the information they need to make an informed consent on that matter. And I think you've raised a very good point. That's part of it. I also want to know that some people may say, well, is it okay to get an mRNA vaccine because we have a large volume coming, so we have that available also? So we think those options should be made available for the public in that. So thank you for that question, and that's part of the overall information material we hope to have ready for our individuals who went ahead and got the AstraZeneca with good advice and direction, and we want to make sure they be able to complete it in a way that they would feel satisfied with the best information, and we want to give that to you in the right time. So we're pushing on that right now.
And John, if I may, it's Dirk Heyer. Thanks for the question. The other things that need to be thought about is supply and the availability and the potential expiry of additional of the vaccine that may be available to us right now. Right now, the dose interval is 16 weeks. So from March, 16 weeks from March is the first planned vaccine second dose in AstraZeneca, and then 12 weeks if there's a specific dose interval exception. So there is some time that we're carefully thinking about, and there's other factors included that I just wanted to mention, thinking about the new supply that's coming, as well as the expiry date of the current supply that we have.
Follow-up?
In terms of supply, how much of the supply that Ontario has on hand is currently AstraZeneca, and how much, I think last time we got a briefing, it wasn't clear how much more we were getting in the near future. Do we have eyes on when our next shipment is arriving? So what do we have on hand and what's coming?
Dr. Heyer?
So we don't know when any additional AstraZeneca vaccine will be coming. We have not had confirmation of that. So we do not have a direct view into it. And we have approximately 50,000 doses of AstraZeneca, approximately, right now.
Next question.
Your next question comes from Jeff Gray with the Globe and Mail. Please go ahead.
Oh, hi, thanks. Yeah, I wanted to go back to that 1 in 60,000 figure, and maybe any one of you could try and contextualize that for us in terms of the thinking about risk from the blood clot thing versus risk from COVID. How does the risk sort of change? Can you give us some context around that number?
Okay, so I'll be asking Dr. Hopkins to answer that one again, but in more detail, because the points that were noted is two things. One, our new information on the risk in Ontario we're seeing with the AstraZeneca at this time, as well as our dropping rates of COVID from where a few weeks ago we were about 4,000 per 4,000 per day. We are now just above 2,000. So things have changed in both ones.